Welcome to Med-Surg Tutor, and in this video we will be going over practice questions for urinary elimination. Before we begin, I want to let you guys know that the questions will be on the video. Feel free to pause to take a moment and select an answer. Question 1. A nurse is caring for a client who reports burning and pain during urination. Which of the following findings should the nurse anticipate? The correct answer here is B, cloudy urine with foul odor. That's a classic sign of a UTI. So for A, UTIs usually don't make you go more, not less. So you'll have increased urinary frequency. For C, severe migraines not really related to the urinary system. And D, bradycardia, that's a cardiac issue, not a UTI symptom. So pain or burning during urination suggests a UTI, and cloudy, foul-smelling urine is a hallmark sign. Question 2. A nurse is caring for a client who has a urinary catheter. Which of the following actions should the nurse take to reduce the risk of infection? The correct answer here is C. Keep the drainage system closed and intact. That closed system keeps the bacteria out. So for A, irrigating every 8 hours, that can actually introduce bacteria. B, bag over the bladder. This increases black backflow risk, which is a bad idea. And D, antiseptic ointment, not evidence-based, and this can actually cause irritation. The best way to prevent catheter-associated urinary tract infections, or CAUTIs, is by maintaining that closed system. Question 3. A nurse is assessing a client who reports urinary incontinence when sneezing or laughing. Which type of incontinence is the client experiencing? The correct answer here is A, stress incontinence. This is pressure-based leakage. So B is urge incontinence, and that's a sudden, overwhelming need to go. C is functional incontinence. That's when they can't get to the toilet in time. And D is overflow incontinence. That's dribbling due to retention. So stress incontinence is caused by pressure on the bladder, which is common after childbirth. Question 4. A nurse is assessing an elderly client who presents with symptoms of a UTI. Which of the following symptoms in older clients is most indicative of a UTI? So the correct answer here is C, sudden onset of confusion or delirium. This is often the first or only sign in elders, but let's look at the other answer choices. Increased urination. This is possible, but not specific, especially with nocturia. Fever and chills. This is less common in older adults, along with that abdominal pain. And then D, painful urination is typically found in younger adults, and foul smelling urine. We're going to see that with every case of a UTI. You want to find that specific answer that's, directed towards the elders. In the elderly, UTIs don't always show up with classic signs. Acute confusion or delirium may be your only clue. Question 5. A post-operative patient is experiencing difficulty urinating and reports feeling pressure in the lower abdomen. What action should the nurse take first to promote urination? So the correct answer here is B. Use a bladder scanner. Always assess before intervening. This just goes back to ADPI. But let's go over our other answer choices. Cold water over the perineum. Not first line, more of a comfort measure. C, encourage urination. Reasonable, but only after assessing. And inserting a catheter is very invasive. You always want to assess first. So a bladder scan helps determine urinary attention and guides your next step, which also this is the only answer in which the nurse is actually assessing the patient. A nurse is caring for a client with suspected pyelonephritis. Which of the following assessment findings should the nurse expect? The correct answer here is flank pain and fever. These point to a kidney infection. But let's look at the other answer choices. A, suprapubic pain. This is more associated with a bladder infection. C, clear urine. This isn't typical for infection. Clear yellow urine. This is what you'll see with, a healthy patient that doesn't have urinary elimination problems. And D, dry mucous membranes. This suggests dehydration, not pyelonephritis. So, pyelonephritis is a kidney infection, flank pain, fever, chills, and possibly nausea are the common signs you want to look for. Question 7. A nurse is caring for an elderly male client with fever, painful urination, and urgency. The doctor orders a urinalysis and urine culture. What is the most likely finding in the lab results for a UTI? The correct answer is A, white blood cells and bacteria. These are clear infection indicators. But let's look at the other answer choices. Protein and sugar. Think diabetes, not a UTI when you hear protein and sugar. Um, Blood and bowel. This is not associated with UTIs and urobilinogen and ketones. This points to livers or metabolic issues. So the clear indicators are the white blood cells and bacteria. These indicate infection. Always check urinalysis for white blood cells and nitrites when it comes to labs. Question 8. A nurse is teaching a female client who has recurrent UTIs about prevention strategies. Which of the following client statements indicates an understanding of the teaching? So the correct answer here is A. I will empty my bladder before and after sexual activity. So it helps flush bacteria and lower UTI risk. Let's look at the other answer choices. B, I should limit my fluid intake to reduce urinary frequency. That can actually increase UTI risk. C, I will use scented feminine hygiene sprays for freshness. This can irritate and disrupt normal flora. And D, I will take bubble baths regularly to keep my perineal area clean. Bubble baths can be fun, but they also raise the risk for UTIs. So, avoiding before and after intercourse helps flush bacteria. So, A is the best answer here. Question 9. A nurse is preparing to insert an indwelling catheter for a client. Which of the following techniques reduces the risk of catheter associated urinary tract infections or CAUTIs? The correct answer here is C, maintaining sterile technique during insertion. But let's go over the other answer choices. A, using clean gloves for insertion. This isn't sterile and won't prevent infection. B, wiping the perineal area with alcohol wipes. Alcohol wipes aren't a substitute for full sterile prep. And D, inflate balloon before insertion. That can cause urethral trauma and isn't the correct procedure for inserting an indwelling catheter. Sterility is your frontline defense. Once the catheter is contaminated, so is your patient's urinary tract. Question 10. A nurse is caring for a client who has a urinary diversion. Which of the following findings require immediate intervention? The correct answer here is dry, dark purple stoma. That's a sign of poor circulation or necrosis. But let's look at the other answer choices. A, bright red stoma. That actually is a sign of a healthy stoma. B, pale pink stoma. This may need monitoring but isn't an emergency. And D, moist stoma with mucus. This is an expected sign of stomas. A sign of compromised blood flow is that dry, dark purple stoma. A healthy stoma should be moist and red or pink. Question 11. A nurse is teaching a client how to collect a midstream urine specimen for culture and sensitivity testing. Which of the following instructions should the nurse provide? The correct answer here is B. Cleanse the perineal area before collecting the sample. This prevents contamination, but let's look at the other answer choices. A. Start urinating directly into the sterile container. That's not midstream, that's collecting the first urine that comes out. C. Collect first and last. That is most likely to skew the results, so we don't want to do that. That's not the correct procedure. And D, you may refrigerate the sample for up to 24 hours before bringing it in. So 24 hours, that's too long, and the bacteria can actually multiply in this state. So cleaning reduces contamination. Always start with proper hygiene before the midstream catch. Right, but to our final question, a nurse is teaching a client who has history of recurrent urinary tract infections. Which of the following statements indicates the need for further teaching? And the correct answer here is I will wipe from back to front after using the bathroom. So that can drag bacteria to the urethra. But let's go over the other answer choices. A, I will drink at least 2 liters of water daily. That's perfect. So we're looking for the red flag here. That's a green flag. B, avoid bubble baths. That's also good advice. And scented soaps. That's good advice. Or D, peeing after intercourse. This definitely helps prevent UTIs. So wiping front to back reduces the risk of bacteria entering the urethra. Alrighty, guys, that was our last question. Happy studying.